Hello, my name is Julia Moncrief, and I will be doing an informative speech on non-Hodgkin's lymphoma. My first audience member is my brother, Clayton Yoder. My second audience member is my mother, Susie Moncrief. My third audience member, and also an honorary member, is Rob Gray, who has survived cancer 3 times in his life. And last but not least is our other honorary member of the audience, my grandmother, Nina Weaver, who is our non-Hodgkin's lymphoma survivor. Imagine you are sitting down having your annual Easter dinner with your family. It is late this year because your grandmother was in the hospital on Easter due to a mass in her abdomen. The family was told everything was fine. Then at the end of the meal, your grandmother has something to tell the family. Her face looks sad and ashen. You know what she is about to say. The results from her test in the hospital have come back, and she has cancer. According to the National Cancer Institute, 1 in 47, or 2.12% of men and women, will develop non-Hodgkin's lymphoma in their lifetime. My grandmother was one of those 2.12%. That was my Easter dinner 1 year ago when my family found out that my grandma had cancer. Thankfully, my grandmother has survived her disease, but it has had a large impact on our entire family. Non-Hodgkin's lymphoma, like all cancers, emotionally and physically affects the patient and their family. Today, I will discuss the causes, symptoms, and treatments offered for non-Hodgkin's lymphoma. First, we will discuss the causes of this disease. According to the American Cancer Society, non-Hodgkin's lymphoma, also known as NHL, has no specific known cause. However, scientists have discovered risk factors involved in this diverse cancer group. Cancer occurs when there is some change in the DNA of cells. DNA changes leading to NHL are not inherited, as they usually occur after birth. These changes can be brought on by exposure to radiation, cancer-causing chemicals, or infections. American Cancer Society. However, most of these changes happen for no reason. They tend to happen as people age. In general, lymphomas are a cancer of older people, as the average age for diagnosis is 66 years of age. National Cancer Institute 2010. Without a definite known cause, doctors must depend on the symptoms to detect the disease. NHL has a wide range of symptoms. This is because lymphoma cancers can happen in many parts of the body. Therefore, many of the symptoms depend on where the cancer is growing. Symptoms can range anywhere from night sweats to weight loss. Fever, chills, and itching are also common symptoms. Any swollen lymph nodes are also a definite sign. These can be located in the neck, underarms, and groin areas. ADAM 2011. Some patients, like my grandmother, may have more serious symptoms. These include a swelling of the abdomen, which can cause constipation, loss of appetite, nausea, and vomiting. Lymphoma can be found in other parts of the body as well. If the cancer affects brain cells, the patient may have headaches, personality changes, concentration problems, or even seizures. When the thymus gland or chest lymph nodes are affected, coughing and shortness of breath may also occur. ADAM 2011. Since NHL has such a wide range of symptoms, doctors have many tests and exams used to determine if someone may have non-Hodgkin's lymphoma, so that they may receive proper treatment. Due to the nature of lymphoma, doctors must go through several procedures to detect and treat the disease. No matter what the symptoms are, the doctor will always perform a physical exam and check all body areas for swollen lymph nodes. From here, there are several directions in which the doctor may proceed. Like my grandmother, the disease may be diagnosed after a biopsy of suspected tissue. NHL may also be diagnosed after a bone marrow biopsy. Other tests may include blood test, a complete blood count, or CBC, CT scans of the chest, abdomen, and pelvis, or a PET scan, ADAM 2011. After the lymphoma is diagnosed, treatment really depends on the type of lymphoma and the stage of the cancer. My grandmother went through chemotherapy and radiation, which are the most common types of treatments. ADAM 2011. Other treatments include blood transfusions and antibiotics to help fight infections during treatment. ADAM 2011. Patients often experience the serious side effects of chemotherapy. My grandmother was weak, nauseous, and in terrible pain. After certain shots during treatment, she said her back felt like it was breaking in half. She also lost all of her hair. According to the British Journal of Cancer, 1997, hair loss, nausea, and vomiting are the 3 most distressing side effects to patients, not necessarily in that order. Non-Hodgkin's lymphoma affects around 70,000 people every year, and while the patient suffers the effects of treatment, the families are forced to sit back and watch, helpless to do anything. National Cancer Institute, 2010. I have had first-hand experience with non-Hodgkin's lymphoma in my family. There are no known causes, and although it is painful, it is one of the more treatable types of cancer. Non-Hodgkin's lymphoma, like all cancers, emotionally and physically affects the patient and their family. Hopefully, someday scientists will find the cure for cancer. For now, I am thankful for the treatments that have allowed my grandmother to still be with us today.